Brain tumors. Before going into details of brain tumors, cell of origin, there can be glial cells, ependymal cells, Schwann cells. Glials are macroglial or microglial. Microglial cells are involved in cellular debris clearance, phagocytosis. They are implicated in neurodegenerative disorders. Macroglial astrocytes or oligodendrocytes. Astrocytes are star-shaped, involved in cellular debris clearance, nutritional transportation, and even regulation of extracellular space, promoting the synaptic conductions. They also are implicated in gliosis after an injury. Tumor formed from astrocytes, astrocytoma, they can be low to high grade tumors from oligodendrocytes, which are cells involved in myelination of neurons in the central nervous system, oligodendroglioma, whereas peripheral nervous system myelination is due to Schwann cells, schwannoma, and ependymal cells which line the ventricles, cuboidal to columnar, involved in secretion of CSF. Tumor originating will be ependymoma. Now, astrocytoma, low grade astrocytoma, is called pilocytic astrocytoma, which are a common tumor in childhood. On CT scan, you have a mass originating in the posterior fossa. On histopathological examination, you have red fibers, eosinophilic fibers, called rosenthal fibers or corkscrew fibers. High grade astrocytoma is on CT, you see butterfly tumor, that is, it crosses the other hemisphere, butterfly glioma. And then you have mostly at the level of corpus callosum. Histopathological examination, you see pseudopalisading, pleomorphic cells. They have central area of necrosis, or there can be hemorrhage also. This is high grade astrocytoma known as glioblastoma multiforme. Glioblastoma multiforme. Astrocytoma is done. Now oligodendroglioma. Oligodendroglioma, you have cell on on gross examination, you have a mass most commonly originating from frontal lobe. Therefore, symptoms are related to functions of frontal lobe, behavioral symptoms. On histopathological examination, you see fried egg appearance, chicken wire pattern, and perineuronal setallosis. These are features of oligodendrogliomas. Next we have ependymoma. Ependymoma. These have classically originate from fourth ventricle. On examination, histopathological examination, you have pseudorosette around the blood vessel, perivascular pseudorosette formation. These are classical findings of ependymoma. Then you have schwannomas, usually a peripheral nervous system, but also seen at CP angle, ice cream cone appearance. On histopathological examination, you have a biphasic cells, hypercellular cells, and hypocellular spindle myxoid area cells. These are classic findings of schwannoma. And then you have some other tumors. Look at this tumor. You see a tumor at surface with a dural tail. On histopathological examination, you see samoma bodies, orally arranged spindle cells. These are classical findings of meningioma. Here you have loss of vision at temporal area, that is bitemporal hemianopia, and mass at sella. These are classical findings of pituitary adenoma, which most commonly will secrete prolactin if it is functioning tumor, or non-functioning tumor will have a mass effect over optic chiasma. Histopathological examination will show growth of one specific type cells. If prolactin, it will be lactotrope cells will be seen. Again you have another mass at stella. Mass at sella which is calcified and may also have mass effect on chiasma causing hemianopias. But on histopathological examination you have cholesterol crystals giving a motor oil like fluid appearance. These are classical findings of craniopharyngioma, which is a remnant of Rathke's pouch. Then we have a true rosette, Homer right rosette on histopathological examination, and on CT you have a mass at cerebellum. Small blue cells can be seen. These are classical findings of medulloblastoma. They have droplets. Then you have tumor where there is so much of blood vessels and the posterior cranial fossa or even cerebellar mass. Case of hemangioblastoma. Okay. Astrocytes will have a GFAP positive, and medulloblastoma will have a synaptophysin positive on immunohistochemistry, and then schwannomas will have S100 positive.